mostly police today.
Yeah, yeah,
Well, that helps us sort of tailor it a little bit.
yeah, absolutely. Well, I'm going to go ahead and get started. My name is Danielle Kawash. I run a company called First in Wellness. We do health and wellness programs specifically for first responders. I want to go thank you for being with us today and taking some of your lunch hour and part of your Friday, and happy Friday to everyone. I have a few housekeeping items. This webinar represents the opinions of my guest, Dr. Amy Nett, and myself, Danielle Kawash. The content here should not be taken as medical advice. In no way does listening to this webinar or asking questions establish a doctor-patient relationship. The content here is for informational purposes only, and because each person is so unique, please consult with your healthcare professional for any medical questions. If you'd like to establish a doctor-patient relationship with Dr. Amy, please go to her website. And if you look in the top part of the chat, if you go into the chat, there's an additional information handout there. I have Dr. Amy's website on there. And I also have a few different handouts that are available. If you'd like, you can email me for those handouts. And just a little bit of more information about ways that you can support your health. So today we're going to be discussing preventative strategies and screening for cardiovascular disease with Dr. Amy Nett. We really encourage questions throughout this discussion. We'd like it to be as interactive as possible. So if you have a question, you can type it into the Q&A box, or you can type it into the chat box. You can also raise your hand if you want to speak out loud and ask the question if you don't want to type. And I can unmute your microphone and let you jump on and talk. And we'll try to answer all these questions during the session. Before we start, I'd like to just get an idea. I already asked for people that got on a few minutes earlier, if you just put in the chat what your profession is, if you're a police officer, firefighter, dispatch, EMT. We want to make this conversation as specific to your needs as possible. All right, enough from me. I'd like to introduce Dr. Amy Nett. She's a functional integrative medicine practitioner working in private practice. She trained at Georgetown University Medical School and then completed residency training in radiology at Stanford University Hospital. Her own health issues allowed her to develop a strong interest in the role that diet, lifestyle, and more preventative approaches could have on improving health and well-being. So she transitioned her career to integrative medicine. She's board certified in integrative medicine and is a certified practitioner through the Institute of Functional Medicine. Her practice is very diverse, though she does have particular interest in cardiovascular health, GI symptoms, and autoimmune disorders. Dr. Amy is married to a police chief, and she has 2 cousins who are highway patrol officers. She has a particular interest in the health of our first responders and knows the world. She's worked with a number of men and women in police and fire and understands the many particular challenges that face you in your profession. So thank you, welcome everyone. Thank you so much, Dr. Amy, for being with us today. I'm really excited to hear what you have to say and learn from you and engage in a conversation. So go take it away, Amy.
Well, thank you very much for hosting this. And, I'm really excited about First in Wellness and just the support you're providing for first responders. Of course, being married to a police chief, I do have a particular interest in all the stresses that we know our first responders have and how that impacts cardiovascular health and longevity. I think, Danielle and I were talking a little bit before we started, and we said, well, should we mention some of the statistics about how stress affects cardiovascular health and the risk factors for, police, fire? And it looks like today everybody we have, I think, is police. So, we thought, well, should we bring these statistics? But they're kind of depressing. So I think we decided we're going to wash those away. And I think the focus of today is what we really want to emphasize is there's a lot you can do for cardiovascular health that we really, Danielle and I really believe in preventative healthcare. And so we do want it to be interactive today. So I would love it if you, raise your hand if there's a question. We'll keep an eye on the chat box, on the Q&A box. It would be great if everyone can walk away with just at least maybe 2 or 3 new ideas of how to approach cardiovascular health, lower your risk for cardiovascular disease, and just support what I like to think of as health span. So I really like to support my patients living well into old age. So you're living well up until the end. So where would you like to start, Danielle?
Why don't we start? I know you talked about the 4 levers, so maybe we can dive into those and start talking about what you can do. I love the idea of having power in your healthcare and power to protect your health.
Okay, so backing up just a little bit, cardiovascular disease, I want to make sure we're all on the same page with this. When I'm talking about cardiovascular disease today, what I'm really talking about is heart attack and stroke. So we could go into more nuance, but really today we're thinking about heart attack and stroke. So heart attack and stroke are primarily going to be caused by plaque buildup in those vessel walls. So that's what we're thinking about today. And some of this context is, I have a lot of patients who come to me, and probably because I'm in more integrative holistic medicine, patients who come saying either they've been told they have to take a statin for the rest of their lives and they just don't want to. Maybe prescription medications, kind of don't resonate with them, or they don't like the idea of being dependent on this pill for the rest of their lives. And some patients have come because they've said, well, look, I've tried this statin, but then I had an adverse reaction, whether it was, the myopathies or the muscle pains you can get, maybe liver enzymes went high. So they say, my doctor said I have a high LDL, so I have to be on a statin the rest of my life. Is this the case? So to answer that question, because I like to work with people more in therapeutic partnership, I like to help us think about this together. So the way I conceptualize cardiovascular disease and how I work with patients is I actually say, well, lipoprotein like LDL, it's important, but it's not the only thing. So I actually say, there are 4 levers for cardiovascular disease that we can influence. We can pull on all 4 of these levers, we can pull on one, but each of these levers influences our risk of cardiovascular disease. That first one is LDL. So your standard lipid panel, your total cholesterol, your LDL, your HDL. So those numbers have a strong influence on cardiovascular health. So we take those into account. But sometimes I think in conventional medicine, that's all that doctors are looking at. So what are the other ways we can influence our cardiovascular health, that we can build our resilience? So the second one is blood pressure. So having a normal or maybe even slightly low blood pressure is going to lower your cardiovascular disease risk. So we can certainly influence blood pressure. Yes, through medication, but also through exercise, through diet, through meditation, stress resilience. The third lever that I think about is inflammation, right? So when I'm thinking about plaque buildup in the vessel walls, we have generally injury to that vessel wall, and then the inflammatory response helps to build that plaque. So if we have more inflammation, we're going to be more prone to plaque formation and plaque progression. So affecting inflammation. So again, a lot of different, and I think we'll probably dive into each of these levers and more specific strategies. But inflammation can be influenced by diet, sleep, exercise to some extent. Either too much or too little exercise can increase inflammation. So a lot of ways we can influence our inflammation levels. And then the fourth lever I think about is sort of a big category of stress and sleep. So sleep is a huge one. Hopefully we'll get into that a little bit more. And we know that one of the challenges with first responders is schedule work. Both long hours, I think, especially when you get, into the executive level, it's just long hours. You guys are always on call. You're working a lot. It can be hard to fit in 8 hours of sleep, probably, especially when you have young kids, probably unrealistic to get a full 8 hours most nights. And then sometimes, when you're in patrol or, fire, highway patrol, right there, you're going to be doing a lot of shift work. So there's sleep hacks you want to think about, even if you have to deal with schedule or just restricted time for sleep. And then stress. So of course, we're going to be big advocates of meditation or other forms of stress resilience. And we can go into that a little bit more. But those are the 4 levers I think about for how can we influence cardiovascular health.
Okay, great. So those 4 levels were the lipoproteins, blood pressure, inflammation, and then a stress and sleep lever.
Yep.
So yeah, so what are you open to diving into some of those, talking a little bit about lipoproteins? You mentioned that conventional medicine typically is doing more of a standard lipid panel that maybe we can talk about and what that means, and LDL and maybe some other testing that's available. Some of that more nuanced testing.
Yeah, perfect. And so I'm going to try, I love this stuff. And so sometimes I get a little into the weeds of it. So if there's something that doesn't feel clear, again, this is where we want you guys to raise your hand or say something if it doesn't feel clear. But I think, what Danielle is alluding to here, I think, is that most conventional docs, what you're going to get is a standard lipid panel. And Danielle, I think, you put together a few slides that we have here. So a standard lipid panel is really basic. So here Danielle is putting up, this is what most doctors are going to order. It's a total cholesterol, a triglyceride level, an HDL, and a calculated LDL. And here we're going to oversimplify a little bit, and we're going to say HDL is the good HDL. So in general, it's going to be protective, and you want to see higher levels. In medical school, we have to remember, learn a whole new vocabulary. And the easy way for me to remember HDL is the good cholesterol. It was HDL is the happy HDL. So H for happy. So LDL, or low density lipoprotein, that's the one we worry about. That's the one that is more strongly correlated with cardiovascular disease. And you ideally want your LDL to be somewhere probably less than 100, less than 120, depending on other risk factors. What's really important is in most lipid panels that you're going to get from your doctor, the LDL is not measured directly, it's calculated. So that actually doesn't give us the best estimate. So if I have somebody who has a LDL somewhere around 120, maybe even up to 130, and their doctor says, oh, high LDL, you have to go on a statin, I'm actually not really comfortable with that, because I don't think we have enough information from this basic panel. So Danielle, I think you have another slide for something that I like to order. And I would suggest if you're looking at cardiovascular disease, or if you have a strong family history, I would suggest having the conversation with your doctor. Could I get an NMR lipoprofile? So NMR, nuclear magnetic resonance lipoprofile, this is a different way of measuring the lipoproteins, and it gives us a lot more information. So what Danielle's showing you is the first page here of an NMR lipoprofile. And what you actually get to measure on this is the LDL particle number. And here you're measuring it directly. You're not just calculating it. So you can see the reference ranges are pretty different here. What I'm generally looking for with an LDL particle number, if I have somebody who is high risk cardiovascular disease, I do want it to be less than 1,000. Someone like Danielle or me, we're pretty healthy, no strong family history, no significant risk factors. I'm okay with an LDL particle number of around 1,200, maybe somewhere closer to 1,300 sometimes. Depends a lot on context. So here we're seeing an LDL particle number of 1,600, definitely elevated. And if we look at the next page of an NMR lipo profile, this is a lot of information. So remember, this is what I like to look at instead of that basic cholesterol panel. So specifically, one of the things I'm really interested in here is the size of the LDL particles. Because again, what we're thinking about here is just because I have a high LDL, just because I have a high calculated LDL, does that mean I have to go on a statin? Well, when we think about LDL, there's a whole range of what those LDL particles look like and how atherogenic they can be. Atherogenic meaning, plaque forming. So think about LDL particles. They can be a big kind of fluffy beach ball. So big particle, it just kind of bounces off the vascular walls. It doesn't really cause that plaque formation. You can also have small dense LDL. Small dense LDL, think of more like a golf ball, right? So it's going to be small, dense, and if you have some sort of injury to the vascular wall, which again is not uncommon, it can occur. We all have episodes of high blood pressure. We all have episodes of stress and things that can cause some damage to the vascular wall. So what is there to potentially form plaque or not? So here we saw that this particular person had, an elevated LDL, but we can dig in a little bit more and say, well, their small LDL is actually pretty low. And you can get a lot more information. I don't think we want to go any further into the weeds on this. I think the point here is there's a lot more information you can get if you really want to understand what is my risk. And we can also say, if somebody has a lot of the really small LDL, there are certain, supplements or nutrients, whether it's niacin or green tea extract, that might actually help influence these LDL particles, might decrease the total LDL particle. So again, when we think about how diet influences cholesterol, cardiovascular health, we can see pretty big changes in these numbers. And again, I think if you have the option to have an NMR lipo profile, that can be pretty helpful. Any questions? So it's kind of, this part's pretty nuanced, but I think it's just good to know that you have options in terms of understanding the lipoproteins.
I'm going to just check and see if there are any questions. I don't see any questions yet.
Okay.
So we'll just forge on. I'm going to reshare my screen because I do have some questions about some additional labs that might be helpful in addition to just looking at LDL and LDL particle size.
Yeah. So I mean, I love labs. It's part of what I do. And to me, they're very tangible, and we can really use labs to make dietary changes or change how we're sleeping, change, the number of hours or how we're prioritizing sleep, or even changing stress management, stress resilience. And you can actually see changes in the numbers. But I did give Danielle some other labs that I like to order. And the first 3 on this slide, these are also related very specifically to the cardiovascular system. And again, I think we probably don't want to spend too much time on labs. If it's something you're interested in, we can always give you more resources. But I think what's important from this slide is to know that there's so much more than just the LDL that goes into this. And a couple of the markers we have here, in particular, C-reactive protein, and especially the high sensitivity C-reactive protein, gives us a lot of information about inflammation. The other marker, LP-PLA2, that's another marker on inflammation. And so understanding, can I just lower my risk of inflammation? Because that's going to significantly lower cardiovascular risk. So again, there are so many different places you can look to see, well, how can I influence risk here? It's not just going to be that LDL. And we also have listed here some nutrient levels, vitamin B12, vitamin D. Most of us are going to be deficient in vitamin D. It's pretty hard to get enough sun exposure, especially, when we're working inside. So I would say most people would do well with vitamin D supplementation, but check in labs to make sure that you're on target, especially in the setting of COVID. And again, a lot of first responders are going to be getting a lot more exposures, just the nature of your interactions with the public. So trying to keep your vitamin D level, again, I would say we have there that desirable is 30 to 80. I'm really trying to keep all of my patients within a vitamin D range of 50 to 60 or 50 to 70 right now, because I just think there's a lot of evidence for, upper respiratory infection support, probably COVID support. So in addition to supporting cardiovascular health, vitamin D is another one that I think you want to keep an eye on. And again, if it's something your doctor's not running once a year, it's a pretty inexpensive lab. probably worth asking your doctor, hey, do you mind tacking on a vitamin D level? And we wrote down, there are a couple different vitamin D levels. So if your doctor's uncertain, you can say, yeah, the 25 hydroxy. And there are also some lab companies where I think you can order directly online. Danielle, is that something that your fire crews have been ordering labs directly, or you help coordinate that with the First and Wellness program?
They're just going through their yearly physicals.
Okay.
Yeah, a lot of them have Kaiser.
Okay.
This is a conversation I actually just had with one department about asking them for a list of what labs they're currently getting and seeing if we could make that a little bit more robust from a preventative strategy. I have a question too about, so if a lot of us, we go into our doctor. So I have Kaiser myself. I go in and I ask for, maybe this whole list of labs, and they can't do it for one reason or another, don't want to do it. If they can only get a standard lipid panel and maybe a couple other more kind of conventional typical labs that most doctors are running, what would you recommend ordering?
Yeah. So I think really great question, because most, especially Kaiser in particular, and I would say, like you said, most of my fire, they do have Kaiser, and I think actually my police as well. And so there should be really easy to get a standard lipid panel. The other markers that I think are pretty reasonable, the comprehensive metabolic panel that you have listed towards the bottom there. Comprehensive metabolic panel is going to give you, very importantly, your glucose level. You definitely want to have this done fasting. So in the morning, after at least 12 hours overnight. Same with that lipid panel. It's just not helpful if you've eaten earlier in the day. So a metabolic panel so that you can get your fasting glucose level, because blood sugar control is huge. It probably fits under a few of those different levers that we talked about. So if you have high blood sugar, it could be in the pre-diabetes range, but even if you're not at that pre-diabetes range, high blood sugar can contribute to inflammation. And your body is going to see that as a form of stress. So I would say get that comprehensive metabolic panel. It also has liver enzymes, specifically AST and ALT. Those are going to be really important to look at. I like them to be close to 20, around 20 to 25. It's a stricter range than most labs. Most labs will say AST and ALT can go to 35 or 40, but you really want those closer to about 20 to 25. I'm pretty picky when it comes to labs, but again, I'm trying to optimize things, not just good enough. So standard lipid panel, comprehensive metabolic panel, vitamin D level, and I think hemoglobin A1C would be the other one I would ask for. Hemoglobin A1C, you have listed there right underneath C-reactive protein, and hemoglobin A1C gives us your approximate average blood sugar over the past 2 to 3 months. So this is sort of taken into account how much is your blood sugar going up and sort of, ebbing and flowing throughout the day. And so hemoglobin A1C gives you a different perspective of your blood sugar beyond just your fasting blood sugar. So again, I think because blood sugar regulation is so important for cardiovascular health, that would be a good one to have. And I think that's a pretty reasonable list to ask for.
Mm-hmm. Yeah, I would agree. Okay. If you want, this presentation is recorded, but you can also email me at Danielle at First and Wellness, or info at First and Wellness, and I can send you this slide deck so you don't have to write down frantically everything. Amy, we also talked about some other screening in addition to lab markers.
Yeah.
I'm just going to pull up a couple, and maybe these are some that people have heard of.
Yeah. So again, this is really in the context for me of risk stratification. So again, a really common question that I'm working with patients on is, do I need to start a statin medication? So if we're trying to answer that question, the two studies here that I normally talk with patients about getting is first, and probably my top priority, that CT, coronary artery calcium score. And then second, maybe that carotid ultrasound. So I think these are two imaging studies, two options for understanding risk stratification that, again, people should know about just so they have the option to have this discussion with their doctor. So the CT coronary artery score is basically, you go into a CT scanner. It's a fairly low dose of radiation that you're getting because we're imaging a very limited section of the body, and you just don't need that many images to do the coronary artery calcium score. So basically what's being done in this imaging study with the CT is you are measuring effectively the coronary artery calcifications, and you're being put in a sort of risk category based on your age. So you'll get a result that might tell you you're, in the 10th percentile for your age, or you're in the 90th percentile, or anywhere in between. But you get some information in terms of your risk based on the amount of coronary artery calcifications you have. So if somebody comes back, over, let's say 40th percentile, I'm going to be approaching my LDL lowering much more aggressively. If somebody comes back with no coronary artery calcifications or a score somewhere less than 10, I'm going to say, you know what, let's just keep working with diet and exercise and stress management, because if you have no coronary artery calcifications, your risk of coronary blockage is going to be pretty low. So I really like this, especially when we have somebody who's right on the fence in terms of starting a statin or not. So one thing, though, to keep in mind is, again, a lot of people come to me, they've already been on a statin. Statins do seem to increase coronary artery calcifications. We don't think that that increases the risk of cardiovascular disease, but they do seem to kind of lay down some additional calcification, and that could be stabilizing the plaque. But that means if you've already been on statins for any extended period, getting a coronary artery calcium score, you're probably going to be sort of over-reporting the amount of calcification. So it'll look a little bit scarier than it actually is. So I always have a hesitation if somebody's been on statins, but it's otherwise a really good test. It doesn't require contrast. So pretty non-invasive study that, again, I'm seeing patients get pretty good coverage for it, patients with a PPO. I have a couple of Kaiser patients who have been able to get this through their Kaiser doc because they've been high risk. So this is something that I think is an option for Kaiser patients, and most patients can work through insurance for this.
Okay.
The carotid ultrasound is the other one I do a little bit less frequently, but it's still useful. So the carotid arteries, you guys are first responders, you know what the carotid arteries are, right? So we can access these really easily with ultrasound. So again, completely non-invasive. You're just using an ultrasound probe, and you're detecting the blood flow. And by measuring the velocities and just actually looking at the vessels, you can detect to some extent the amount of plaque and the degree to which it's impairing blood flow. So this is going to be, carotid ultrasound looking more for risk of stroke, coronary artery CT scan looking more for risk of heart attack. But again, both of these are just different ways of understanding what is my plaque burden already. If it is higher, you are going to be more aggressive about lowering your LDL. So you would lower your LDL particle number to less than 1,000. Or if we're working with calculated LDL, you have to be less than 100. And one other thing, I think we don't want to spend the whole time talking about labs because there's so much else to cardiovascular health, even though I love labs. But one other thing is, from my perspective as, again, kind of an integrative holistic medicine doc, I have seen some cardiologists who feel that there's no such thing as a cholesterol that's too low. And I've had people come in with a total cholesterol of like 110 and a calculated LDL like 35. I think that a total cholesterol of 150 is the lowest I would actually want to see it, because cholesterol is really important for the brain. It's really important for sex hormones. It's important for the nervous system. And there actually seems to be a correlation with cholesterol, total cholesterol of less than 150, and cognitive decline. So another big group of patients I work with is Alzheimer's patients and cognitive decline patients. And we actually want to make sure that even though we want their blood pressure, their LDL, their cholesterol controlled, we don't want a total cholesterol dipping below 150. So it's another consideration. It's nuanced, and I think sometimes cardiologists, understandably, they're looking at the cardiovascular system. And from that perspective, you probably don't need cholesterol within the cardiovascular system, but for the brain, sex hormones, you actually do want some cholesterol around.
I'm really glad you brought that up. That's a discussion I have with a lot of clients as well. Fantastic. Well, I know we've spent a bit of time on labs, so I want to make sure we work through the other 3 levers.
Yeah.
And the next one was blood pressure.
Yeah. Okay. So what I would say for blood pressure, because again, hopefully we'll get some take-home points that people can actually make changes. So what I'm going to suggest is people invest about $50 and get a blood pressure cuff so you can measure your blood pressure at home for 2 reasons. One, I think it's cheap and easy. That, it's a very accessible metric. And, when we go into the doctor's office, I know when I went last week, and I'm kind of in a rush, I'm fitting it into my day. Like, it's not always the best time to measure your blood pressure. And so I think it's nice to measure blood pressure. You can either do it a few times throughout the day or just do it before you go to bed. But I think every couple of months, just check in. The other reason I think it's good to measure your own blood pressure is a lot of times, again, when I've been to the doctor's office, there's someone who checks you into the room, but they may not have been trained on how to take blood pressure the best way. And so when they take my blood pressure, I know they put the cuff on my arm dangles by my side. They hit the button while they're doing something else or asking me a question, and that's my blood pressure. So I would say let's learn how to do blood pressure the correct way. So the way you want to take your blood pressure, and I like the Omron, OMRON is the company for the blood pressure cuff that I get. And Danielle, I don't know if it's easy to send a link to people in case people want to look at this. And I think it's the Series 3. It's their least expensive manual cuff, and makes taking your blood pressure very easy. What you want to do is you just want to sit down in a chair, both feet flat on the floor. But importantly, you want to choose an arm. It doesn't matter which one, but you want your arm to be resting. I often use we have a wood tissue box holder, or you could do a pile of textbooks or, something like that. But you want your arm resting on something comfortably, and you want it at about the level of your heart. So you want your arm relaxed at the level of your heart, and that's when you're going to take your blood pressure. Take, a nice deep breath in, and then you take your blood pressure, but both feet flat on the floor and your arm resting on something at the level of your heart. And that's how I think you'll get your most accurate blood pressure reading. And the number you're looking for is 120 over 80. If it's a little bit lower, that's great too. And if it's above, I would say 130 over 85, they keep kind of lowering the blood pressure ranges. I don't know if you've seen that, but they kind of keep coming down and saying, well, maybe this is optimal. So we're kind of realizing that, blood pressure is important. And so if it's above 130 over about 85 or 90, then that's something you probably want to talk with. Again, you might start with a nutritionist. You might want to talk with your doctor, but I would really aim for that 120 over 80. And the reason is, if you think about your vascular wall, when your blood pressure is high, you're putting a lot of tension on that vascular wall. It gets very taut, right? And it's going to be much more prone to injury, some sort of injury. And then you get those small dents, LDLs, right? Like the little golf ball LDL particles sort of creep in there. And that's how you get plaque formation. So if you have lower blood pressure, your blood vessels are going to be a little bit more relaxed, a little bit more resilient. They're going to tolerate the normal kind of shear stress, the normal trauma of living a little bit better. So I would say for blood pressure, that would be my big take home. And then I think we'll probably talk about blood pressure when we get to sleep again too.
Yeah. And I did have a question about, and maybe you're going to touch upon this when we talk about sleep, but two questions. One is if someone has been told that they have high blood pressure, it's kind of borderline. How often should they measure their blood pressure? Because I know you mentioned every few months. And then also, what's the best time of day to check your blood pressure?
Those are both really good questions. And I would say if you're told you have borderline high blood pressure, I would probably do something like taking blood pressure maybe 5 consecutive days, both morning and evening. And if it looks okay and the plan is, let's make lifestyle changes before taking a medication, then you probably check in once a week. So it depends on what you're doing with those blood pressure readings, because to just keep taking it, you know what I mean? What are you doing with that information? So it probably depends a little bit on, well, what are the strategies that you're employing? Are you actually doing it to track changes? In which case, maybe just, once a week. Again, it's so easy that, to do it like once a week or something for a while you're learning your ranges can be a good way to do it.
Okay.
And then in terms of morning versus evening, I would say, we generally do our blood pressure, here, we generally do our blood pressure in the evening before bed. And I would say partly because for us in the morning, we've got the whole day ahead of us. We're kind of, gearing up and we're trying to get things done. And of course, our cortisol, our stress hormone, is naturally higher in the morning. I know I feel more stress in the morning as I'm kind of anticipating the day ahead. So I don't necessarily want to check my blood pressure at that time. It could be good to know where you're ranging. So you might check it sometimes in the morning as well. But I would say in the evening, I think fits into most people's routine a little bit better. So the best time to take your blood pressure, of course, is when you remember. But
Okay.
I think evening's perfectly fine if that's where it fits.
Great. Okay. All right. Well, I'm anxious to hear about inflammation, that third lever.
Okay, so inflammation's a big one. And we talked about, or I mentioned briefly, so when I'm thinking about inflammation, certainly there are some labs we can look at, is your C-reactive protein elevated? But so where can we lower inflammation? Diet's a big one. And we talked a little bit about blood sugar when we were looking at labs. So blood sugar can really be a source of inflammation, and high blood sugar can also damage the vascular walls. So Danielle, you have a background in nutrition. What are your top 3 dietary changes if you wanted to lower inflammation through nutrition?
Right. Okay. So first one, you just mentioned high blood sugars with inflammation. So the lowest hanging fruit, if you can change anything in your nutrition, is to start reducing added sugars in your diet. And so I'm not referring to sugars that are naturally occurring in fruits and vegetables. I'm referring to the added sugars that are added in packaged foods. So if you look on a food label, you can actually look and see how many added sugars there are in that food. If you look at the food label, it'll have the total sugars and then it'll have added sugars. And what I typically recommend for people to do is to try to make a goal of reducing their added sugars to 20 grams or less per day. Sometimes the best thing to do is just get the information and start just looking at food labels and writing down everything you usually eat for a day and just write down how many added sugars are in that food. And then total up at the end of the day and just see where you start. So that's one thing. The second thing I would say is just to get more color on your plate. So all those colors in your fruits and vegetables are called phytonutrients. And these are incredibly powerful nutrients that protect you from things like cardiovascular disease. They can actually start to heal up those blood vessels and reduce inflammation. And they also can help to protect from things like cancer, help with blood sugar regulation, help with cognitive health. So they're pretty powerful. So the more colors you can get on your plate, I always tell people, try to eat the rainbow at every meal, the better. So herbs, fruit, vegetables, just make your plate look really pretty. In fact, I remember I was working for a doctor one time and he was trying to lose weight. And I said, well, how about I just bring you lunch every day I'm here? And I remember him opening up a container one day and stopping going, it's so pretty. And he lost like 30 pounds and got off all his medications and everything. But adding colors was one of the ways, because it's naturally going to help your body start to shed some pounds. And then the third thing that I would say, behind sugar and getting more colors on your plate, I'm trying to remember what I told you before. We had this conversation a little while ago.
I think one of the ones you and I were on the fence about was alcohol. That should be the third or the fourth.
Yeah, there was alcohol and there was one more, but definitely limiting alcohol to less, 2 drinks or less for males, 1 drink or less for females. That's going to be a huge cause of inflammation in your body. It's also going to affect your sleep, which is again going to affect inflammation and blood sugars. And then God,
one other one, I think, and this goes along with the color, but I think increasing vegetables, and maybe that's the same thing as color, but just getting your maybe 4 to 6 servings of vegetables.
Yeah.
I mean, I would say for most of my patients, I say 8 to 10 servings of vegetables, but I would say, yeah, depending on where we're starting, go with 4 to 6 servings of vegetables.
Yeah, absolutely. And if a number is scary, just try to get color on your plate if you don't eat fruits and vegetables. And if you only eat 2 colors, like green and orange, like carrots and beans or peas, then maybe try to like branch out on that rainbow and integrate some other colors. One thing I think a lot of people don't talk about in regard to, inflammation and blood sugar regulation with meals and nutrition is the timing of meals. And so I typically am recommending, trying to do a fast overnight of 12 hours, and we can talk about longer fasting in another conversation, but, minimum of 12 hours. And then the other thing is just have planned meal times and not snacking throughout the day. And so
makes a big difference for blood sugar control. Because again, that hemoglobin A1C is affected. That's your average blood sugar over 2 to 3 months. So every time you eat throughout the day, you get a little spike. So that's what you're saying is if you're eating 5 times a day, then you're going to get 5 blood sugar spikes throughout the day. So if you can eat just 3 times within a day, already you're improving your blood sugar regulation. Yeah.
Yeah, absolutely. All right. I'm expanding. I'm on 5 now, I think. But the last thing I would say is eating healthy fats. And the big fat, I would say, when we're talking about cardiovascular disease and inflammation, is to get rid of those hydrogenated or trans fats. And I don't know if you want to touch on those at all, but
are those even around anymore?
They're banned in a lot of other countries, but we still have them in the US. So sometimes you have to be a bit of a detective to find those in your foods, because it can say 0 grams of trans fat on the food label because they have to list it by law, just like they have to list sugars and added sugars. But they only have to list it if it has 0.5 grams or more. So if it has 0.4999999 grams of trans fat, then it still has some trans fat in there. And then if you're eating multiple servings of that food or other foods that have a little bit of trans fat in it, then now maybe you're up to like 5 to 10 grams of trans fat a day. And trans fat is lethal. There's nothing good about it. It's highly inflammatory. It's if you want to try to shorten your lifespan and not have a great end of life, eat more trans fat. So the way to find it is to look in the ingredients. If you see anything that says hydrogenated fats or partially hydrogenated, or what's the other one they listed as? I'm blanking. Not lard. Oh my goodness. This is an embarrassing thing as a dietitian. I can't think of the third. If I think of it in this,
you'll come up with it.
Yeah, I'll let you know. Shortening. Yeah, all of those mean there are trans fats in it. So those would be my top, I guess, 5. You asked for 3.
Yeah, that's a good one. The inflammatory fats will actually do a lot. And it's really interesting. And some of my patients who, or when we're starting out and they eat out a lot, a lot of the oils that restaurants use are the cheaper oils like canola oil, soybean oil, corn oil. And those are really inflammatory fats. And you can get into omega-6 versus omega-3 fats. And that's, a whole discussion in itself. But I've found that when people do, a 30-day commitment to just preparing more of their meals at home, or if they're eating out, trying to do something, like a salad and then just top olive oil on it. So you're removing a lot of those inflammatory foods. That C-reactive protein, again, I use labs to monitor progress, right? But that C-reactive protein really comes down and people often feel better, sleep better, that sort of thing. And then the other thing that you were mentioning that I loved is all the color on the plate, including the herbs. I actually used to completely overlook, rosemary, cilantro, parsley. I thought, oh, that's so much extra time for, just a little extra flavor. But, now that I've sort of been in this world of holistic and preventative medicine for a lot longer, I'm realizing all the benefits that come, especially from herbs and all the different plants. And a lot of things that people come to me is for prevention of heart disease, cancer, and cognitive decline. I mean, I feel like that's on so many people's minds. Like, how do I not get cancer? How do I not, have Alzheimer's, cognitive decline? And it's so, there are a lot of supplements I use in protocols with people, and a lot of them are just derived from foods, rosmarinic acid, just from rosemary. I do green tea extract, and if you can just put those on your plate, you're going to save yourself quite a bit. You'll improve your health span and save yourself from taking, these supplements or medications down the road. So yeah, I love the color and I love the herbs. They're actually really important as well. So
I agree. And herb gardens are so easy to grow and they don't take any space. So that's my favorite part of my garden. Yeah. And I love that you mentioned kind of the end goal is just to feel great. Like these things are going to help you prevent or highly reduce your risk for cardiovascular disease, cancer, cognitive decline, but you're also going to feel better.
If your blood sugar is stable, you're going to feel a lot better, right? Because when your blood sugar goes up too high, that drives up your insulin, which drives blood sugar into your cells. So then your cortisol, your stress hormone, increases just to get glucose back out of the cells. And so that's why sometimes if we eat like a really high sugar meal, you get that crash. Kind of jittery as your cortisol, your stress hormone kicks back in, right? And so you can just be on this roller coaster of glucose, right, blood sugar and cortisol swings. It's really kind of uncomfortable. Mm-hmm.
Yeah. Talk about swinging energy levels.
Yeah. So, all right. I think we have about 10 more minutes to touch on our last lever, which is sleep and stress. So I think you and I have both really enjoyed that book, Why We Sleep by Matthew Walker. And, it goes over a lot of the importance of sleep and the importance of different phases of sleep. And I think one of the things that really kind of came to my mind in the context of first responders is one of the things we do when we sleep is process trauma.
Yeah,
so
absolutely.
I think, and again, it comes a little bit, we know that, when you have young kids or you have a busy life and this, career that takes up a lot of time, you don't necessarily have a lot of time for sleep. So what's one of your favorite sleep hacks?
Well, I mean, you mentioned sleep and processing trauma, and I know we just touched upon alcohol when we were talking about inflammation. And I mentioned sleep, but when we drink alcohol at night, especially close to when we're going to bed, or if we drink too much, then it actually reduces the amount of REM sleep we're getting, that rapid eye movement sleep when we're dreaming. And during that stage of sleep, this is when we're actually processing everything that happened throughout that day. And we are processing any trauma. So in that deep sleep stage before that kind of deepest stage of that non-REM sleep, our brain's kind of cleaning itself out and making room for this new information. And then REM sleep, we process all that information. So if we're drinking too much, or if we're not getting into those deeper stages, that deep sleep and REM sleep, then we're not allowing our bodies to process that trauma. So that's going to definitely increase your risk for any psychological health issues.
And you brought up, that also makes me think of, you brought up the timing of eating and, trying to get 3 meals a day. And one of the recommendations that I make, especially for cognitive decline patients, but this really comes in for all of us, is trying to eat your last meal. If possible, it's hard, 3 hours before you go to bed. And the reason, and I mean, look, I'll be honest, I think we normally get it maybe 2.5 hours before bed when we're, both working. By the time I, get dinner on the table, it's just life. You do your best. But the reason behind that is, as you mentioned, when there's two reasons. Number one, we just seem to sleep better. So, sleep studies have shown that if you're going to bed with kind of an empty gut, right? You don't have to be hungry necessarily, maybe just the slightest bit, but if you're going to bed with an empty gut, then your body seems to get into that deep sleep earlier in the night. And for those of you who wear sleep trackers like Oura rings, pay attention to when you eat, and you will see that your core body temperature lowers earlier in the evening and you start getting into deep sleep sooner. The other benefit of eating at least 3 hours before bed is, Danielle, I think you mentioned that we're kind of doing this cleanup when we sleep. There's actually a lot of detox, like repair and detox while we sleep. So if you think about when you do spring cleaning at home, right, you do not do it in the middle of a party, right? All your friends over, right? It's kind of like when you just ate and your digestive tract is full, your body is busy with the nutrient digestion and absorption, right? That's your big party. You're not going to go spring cleaning. So again, if you wanted to do a deep clean of your house, you're going to wait until, your husband's out of the house, he's taken the dog out of the house, you have the place to yourself, right? Like that's when you're going to get in there, you get in all those nooks and crannies. Same thing. That's our brain gets the chance to really clear out like the lymphatic system overnight, and we do our detox. And I love that you recommend, at least 12 hours fasting overnight. I tend to be a little bit meaner with my patients, and I tend to say, let's aim for 14 hours overnight. Definitely more data in terms of this, overnight fasting of 14, 16 hours in men than there is for women. Women, I think it's much more of an involved conversation. But for men, 14 to 16 hours overnight, there's a lot of data that we are going to improve lipid panels. We're going to lower risk of cardiovascular disease. We're improving insulin sensitivity, which is going to improve your blood sugar regulation. When you do these little fasts, I'm reluctant to even call 14 to 16 hours a fast, but we're going to go with it for now. You're sometimes getting into this process called autophagy, which is helping to clean out some of the older kind of cellular material. So again, you're getting into this deep cleaning. It's really our chance to do spring cleaning. So I think, in the context of both sleep and diet, again, these things are all interconnected. But the timing of meals and both alcohol and just your last meal of the day, where those fall relative to when you go to sleep, makes a big difference.
Absolutely. Yeah. And just for time's sake, because we only have a couple minutes, I do want to mention that we do have handouts on a whole bunch of sleep hygiene, things that you can do, because we realize as a first responder, you have limited time to sleep sometimes. But if we can up the quality of that time of sleep and then really concentrate on sleep hygiene and maybe using some of the sleep hacks on the days off, you can start to really optimize your sleep and improve your health and feel so much better. I do want to touch on stress modulation really quickly. And if there are any questions, we'll stay on a little extra, but I want to be respectful of your time.
So stress is another big one, right? And so I think at least a couple people from Palo Alto, so they've certainly heard about meditation and Courageous Heart. So I think we'll certainly kind of give a nod to Courageous Heart as a way to develop stress resilience. But because we know, we think about cortisol as the stress hormone. And we know that first responders have higher cortisol levels. That's part of the job, right? And again, that's why we don't want to go into the statistics of, how bad this is for you. And again, through my medical training, I remember having weeks of working, 80 hours a week, and how bad it is for you, but it's just part of the deal. So the question is, how do we improve our resiliency? How do we recover faster from this? So we know that cortisol levels are high. So the question is, how can we increase our resiliency? And, there are so many different ways to do this, whether it's setting aside more time for play, which can sound kind of funny, but really just making sure you have that outlet. Of course, I'm a fan of meditation and more structured kind of stress management programs. But I don't know, is there something specific on that, Danielle, you want to touch on? I feel like it's such a big topic, and we all know how important stress is. It's just, how do you manage it,
Yeah, absolutely. Well, I mean, so we have a handout on this as well. So just
Awesome.
email me if you want this handout. I encourage you to open up that additional information PDF I have on the top there. One thing I always like to say is, we train our bodies for, the job that you're doing. You train your bodies in fitness so that you can perform the job you're doing. We also, just because of the world, this crazy world we live in, being on our phones all the time, everything's quick and rapid, and we're always on. And then now layer upon a really stressful job. Especially right now, being a police officer, from what I've been told, and of course, I read the news, you have to train your body to regulate stress and modulate stress. And when I think about training with fitness, if you're going to be fit, you don't just train once a month or once a week. You usually train on a regular schedule. And it's the same thing with training your body to be able to be more resilient to stress and to lower those cortisol levels and get back to what we tend to call homeostasis. We need a daily gentle reminder to be training our body like, hey, it's okay to relax. Like, this is how you do it. And so I usually recommend 5 minutes a day of some sort of stress modulation. There are a bunch of ideas on that handout. Amy's mentioned meditation, but 5 minimum minutes in a day, 5 makes a massive difference, and doing it daily. So that repetition, it just is a reminder. It's kind of like when you pet a dog's head, it relaxes. It's the same thing. I mean, pet your head if you want for 5 minutes. So
yeah, I really, I was doing a meditation class one time, and I remember somebody asked the meditation teacher kind of, well, how much should I meditate, And he said something like, look, now that we're adults, most of us, we floss our teeth every day, right? It's just something that you do. You don't necessarily enjoy flossing your teeth. It's just in the routine. And he said, look, same thing with meditation or whatever practice you're choosing, whether it's listening to like a relaxing music, petting your head. I like that. That's fine. But it's just something that you do every day, and it's only for a couple of minutes. If it feels good, you want to do it longer, great. But it's just something that you get into the routine of doing, because it's just sort of part of the hygiene for keeping, optimal health, really.
Yeah, absolutely. Well, we're about out of time. I want to mention one other resource. We do have a program that individuals can sign up for. It's a 90-day resilience program where we delve a lot deeper into all these topics. And we're offering $100 off today. There's a code on that informational PDF. So if you have questions about that, you can take a look at our website. You can email me, you can call me. It's there for you guys. And gals, we're here to support you. And I want to thank you so much, Amy, for taking the time. I know you're really busy, and really appreciate you taking the time today to talk about this really important topic. And I want to thank all of you for attending. I know everyone's really busy and you have a lot of options. And so thank you so much for attending.
Thank you, Danielle. Thanks for hosting.
Thanks.
Bye.